Hello and welcome. Thank you all for joining us today on this very bright, summery Davos like never before, really. Hi, I'm Sonal Mehrotra Kapoor, and joining me today is the Minister himself, the Honorable Minister K.T. Rama. He's Minister for Industries, Commerce and IT. We also have with us Mr. J.V. Prasad. He's co-chairman MD for Dr. Reddy's, and Mohammad Athar from PwC. Thank you all, gentlemen, for joining us today. For everybody back home watching as well, this is a very important conversation. We're discussing life sciences today. Now, post the pandemic, there has been a major shift in the world on how people, industry, different players really view life sciences. It's said to be the era in which we will be looking at medical care facilities and everything around it very, very differently. Of course, big learnings from the pandemic have been plenty. It's been a boom as well. But what we're going to discuss here now, over the next 30 to 45 minutes, is what next, and how does really India capture that space? Let me begin with the Minister. So when it comes to life sciences, there are a couple of pillars which really are the key in building this entire system. One is infrastructure, second is innovation, then is capital, etc. I want to begin by talking about manufacturing and infrastructure at the moment, something that has gone, would you say, pretty well so far?
Well, thank you, Sonal, for this opportunity, and thank you to your team as well for showcasing us from Davos. In fact, this pandemic has literally shown, not just to us, but the entire world, how important healthcare is, how important the entire life sciences industry is. In fact, we don't thank them enough, the entire pharmaceutical industry, the entire vaccine industry, the biotech industry. How invaluable they are is something that came to the fore during the pandemic. So let me thank, for lack of others on the podium, I think I should thank Prasad and the entire pharma industry of India. And in fact, one of the most important hubs for pharma industry in India is Hyderabad. For those of you who do not know, Telangana, in fact, is not just an important hub in India, but in fact, it is an important life sciences hub in the world. And the reason why I say that is because since we're just coming out of the pandemic, let me remind each and every one of you who's watching that 1/3 of human vaccines are actually produced from Hyderabad, globally, not India. In fact, 9 billion doses are produced, 9 billion doses of vaccines are produced from Hyderabad, and that accounts nearly to 1/3 of global vaccine production. So we are the vaccine capital of the world, not India alone. And then let me also add quickly, 40% of India's pharmaceutical production also happens from Hyderabad. And the third thing I'll quickly add also is that largest number of US FDA-approved manufacturing facilities in any province in the world are actually in Hyderabad, in Telangana. The second largest number is in New Jersey. So that goes to show you the importance of India's role in the pharmaceutical life sciences spectrum, and most importantly, how important a role Hyderabad and Telangana plays in that value chain. Now, going back to your question about how the manufacturing ecosystem has evolved over the last several decades, I think we've done okay. I wouldn't say we've done well. I think we've done reasonably well, but I think a lot more needs to be accomplished. One thing I believe, besides what you said, innovation, infrastructure and innovation, while these are extremely important pieces to talk about, I think a conducive ecosystem which nurtures, conducive regulatory framework which nurtures and encourages innovation and research and development by way of even incentivizing them is something that is sorely missing in India, unfortunately. And the second thing, unfortunately, we don't think on scale. In fact, if we have to compete with the best manufacturing destinations, biggest manufacturing destinations across the world, we need to start thinking on scale. In fact, Hyderabad and Telangana, we are launching world's largest pharma cluster in about 19,000 acres. I think that is when it will become a project of international importance, not just national importance. So we need to think on scale. We need to have more conducive governance towards innovation and nurturing our talent. I think that is what is missing right now. We've done okay because we've done okay because where are the real innovations coming from in the world today? Definitely not from India. I mean, while we can claim to be doing a lot of other things, innovation is not something real innovation is not something that's happening. I know Dr. Reddy's has tried and is trying, but it's not happening at the scale which it should. That's my point.
Right. Don't we all love a minister who's humble enough to say that, no, it's not okay, and not just going on about everything that has been achieved so far? So thanks for that. Let me come to you, to Prasad. Big learnings, firstly, from COVID so far, and how do you see this life sciences space evolve at the moment, at least?
So, talking about COVID, I would say that COVID has given great focus to the companies and also great recognition. I'm very proud that, Mr. Honorable Minister has said that this is a strategic industry and it's important for the nation and the state. So that was very good. The other thing we discovered is that we could do a lot in a lot less time than we are used to. If you look at how new vaccines were developed, it was done in a fraction of the time that it normally takes. And this takes the whole village to do this. It's not just the company itself. Government has to help us. Hospitals have to do the trials. And the regulators in the country have to accelerate the process. All this happened during COVID.
Right.
And that was the most beautiful thing to witness for us. Collaboration between the regulators, the industry, the whole ecosystem. And I hope that continues so that India can really become a leader in innovation. And I'll come to innovation a little later,
right,
what we should do there.
Right. So what I'm hearing from you is that COVID and the pandemic in a way did put life sciences at the center of every conversation. Yes. The fact that states, governments across the world really are talking about it. But give me your thoughts on what next. As we come out of this pandemic, as we all meet up in Davos again after a hiatus of about 2 years or so, what next here?
So my father-in-law, Dr. Reddy, was a founder of a company, has written his biography, which is The Unfinished Agenda. And this is an unfinished agenda not just for the company I represent, but for the entire Indian industry. We have to innovate. We've mastered APIs. We've become a leader in vaccines. We've become a leader in generics in the world, and so all these are phenomenal achievements. But we are yet to see real innovative products come out of our labs into the world markets, and that is the unfinished agenda. And I think we are going to get that. Maybe in the next 10 years, we will see a wave of growth coming through innovation. One of the great things that the governments have done is attract global companies into Hyderabad, and they strengthen the ecosystem. Of course, they recruit our best talent, and we also hire from them. It makes the market for talent much more aggressive and competitive, but it's in the long run good for talent and good for the companies. The ecosystem for innovation will evolve, will accelerate, and we'll see some of the drug discovery activity shifting from the West into India, and hope.
Right. So that's a huge agenda, shifting from the West to India and other parts of the world as well. But how exactly to do that is something I'm going to circle back to in a moment. Dr. to you next. Just firstly, for everybody watching out for trends in life sciences and spaces like these, right? If you were to point out 3 quick things that you see as evolving internally in this sector over the, say, next 1 year, let's talk about Davos to Davos now, okay? So next 1 year, what are the big 3 things that you see as evolving?
Yeah, so before I come to the 3 trends, I think one point I wanted to, belabor along with what Honorable Minister said and Mr. Reddy said was, here is one industry where we will be really proud of the way, the way software industry really, brought a lot of laurels to this country. The time for this industry has arrived, and COVID really accelerated a lot of initiatives.
Yeah, established the pharmacy of the world.
It really did. Yeah. So from that perspective, it's there. I think what you will see as trends that will, keep on shaping up this journey, and this could be a trend because medical devices, life sciences is a, industry which has a lot of diversity of products, a lot of diversity of segments within that. So people and industries will take various paths, but what you will see is that we were earlier a country which was very focused on high volume and low value added products, which is a lot of over-the-counter drugs and consumables. You will see we will start shifting towards high value added products in certain sectors in industry, and that's absolutely going to happen. The building blocks are already there for us. The second thing you will see, the role of digital in life sciences and life sciences service delivery will become very prevalent. We are seeing all over, how the digital is becoming part of the big healthcare agenda. That's The third, you will see there will be much more focus on, using technology to reduce healthcare costs, because that's a major, expenditure item, and that will become a big agenda, and that will drive innovation across various, companies and services in terms of, products that are getting created or manufactured, and those three things will really drive a lot of activity in the next 2 to 5 years that we'll see.
Right. Key, all three very, very important points there on the journey forward, really. I want to move to innovation next. So, and just want to understand your thoughts on what exactly, not just Telangana, we are Team India right now, right? What exactly is the state and the center at the moment doing to fight out with competition at the moment when it comes to innovation? We've got countries like Ireland, Malaysia, Singapore, all giving like major tax deductions as well to invite more people to come in, invest, innovate, and if that's the journey you want to take as well, how are you seeing the blueprint?
Well, firstly, let me quickly add, going back to Saif's point about innovation and technology, I think what's important for us to realize is over the next 1 decade or even half a decade, I think innovation will not just happen in pure play labs, not just in laboratories, but in fact, it will start happening more on the digital spaces. In fact, one of the things that I keep alluding to and that I keep talking about my city, Hyderabad and Telangana, is I keep saying Hyderabad is that place where biology meets technology, where data sciences marries life sciences, and it's a brilliant combination. Because today, for instance, Novartis, a world-class pharma company, has a large footprint in Hyderabad with more than 8,000 people, and they are into digital drug discovery. They employ people who have expertise both in technology and life sciences as well. So it's a very interesting kind of a synergy that is going to emanate. Now, I believe that if India really has to get a foothold in the innovation space and really make its presence felt, not only in pure play R&D, but we also have to focus a lot on innovation that happens in the digital space. In fact, we are on the verge of launching a very interesting world-class university in the pharma city. In fact, we've entered an MOU with the King's College in London day before yesterday. What we are looking at is courses in drug discovery, courses in digital data sciences, where these spheres intersect, these spheres actually talk to each other, and some real innovation can happen. Now, going back to what we as a country need to do. Unfortunately, Government of India, which is supposed to encourage innovation, supposed to encourage research and development, has reduced the input incentive that was given from 200% to 100% on research and development. Now, that is something that we've asked the Government of India, in fact, a couple of years ago as well, that we need to encourage our enterprises into investing more into R&D. We cannot disincentivize, and we cannot be content being the leaders in generics and APIs.
Yeah.
Because that is, of course, important and laudable, like Prasad said, but it is the lower end of the spectrum, whether we like it or not. Not a lot of molecules have been discovered in India. Not a lot of large molecules have come out of India. So the real innovation, the real money, the real value, real bang for the buck, as they call it, is in innovation, and companies need to be encouraged because there is no dearth of capital now. If you look around, there's no dearth of capital. In Davos, if you go around, I'm sure Prasad is meeting lots of very interesting prospective investors, etc., who are interested in innovation. But the fact is, we need to have a conducive regulatory framework for this capital to come in and be invested. Because, remember, this is risk capital. This is not your capital which has a guaranteed return, easy return, etc. This is risk capital. And risk capital needs to be treated as risk capital, and it needs to be incentivized, which is unfortunately missing. And this is where Mr. Piyush Goyal and Mrs. Sitaraman need to seriously rethink on their strategy on encouraging more R&D happening in India.
Right. Point taken. So then just to come to you next, the Minister also talked about how there is enough capital, but these are interesting times, really, isn't it? With everybody talking about a looming recession, with sort of a funding freeze coming in, a lot of recalibrated approach on how things are going to move forward. Life science in space, how is that looking?
So first, before I get to the funding equation, I think there is one great opportunity in front of us. This is the age of biology. There's a lot of dramatic changes happening in the technology, in the biology space. Whether it's mRNA, whether it is vector-based delivery of drugs, computational biology, CRISPR, all of this. And here we are not very far behind. Some of the labs in Hyderabad can do CRISPR, and they've been doing it. We need somebody who can string the beads and create innovation from these tools that we have. And a strong investment in biology will have dramatic impact in innovation. So that's one part I would request state and central governments to look at how we can improve the biology ecosystem.
Can I highlight a gap there as well?
Yeah.
During COVID, genome sequencing.
Yeah.
Everybody in India now knows what that means.
Yeah.
And there was such a dearth of good centers that could actually do that. And constantly in our conversations and speaking to doctors, he said, there are so many scientists. What we need is, again, exactly what you said, a tool to string it all together.
Yeah. And it's not that difficult to do for us. We have the foundation there. The next thing about capital is capital will follow the innovation.
Sure.
So I don't see capital as a dearth. I see talent. I see the deep skills required for innovation and the ability of entrepreneurs to leverage the sciences to create breakthrough innovation as the task before us. I think capital will come if we do the right things.
Okay, 3 things that you think Telangana, government of India can do at the moment.
I think Telangana is doing a lot already, and I'm looking forward to this industrial park coming on stream. The knowledge hubs are already there. We have CCMB, we have University of Hyderabad, we have IICT, and a lot of higher educational institutions, research institutions existing there. I think I'd like the central government and also the state governments to encourage individual entrepreneurs. I would actually, one of our early discussions with the minister was to ensure that faculty get the right to own equity in the spin-offs that they can do and really motivate them.
That's where all the brain drain happens in India.
Yeah, if you go to an institution like MIT, every professor has 3, 4, 5 startups, and they become very rich, and that creates greater motivation for others to do more innovative work.
I absolutely agree with you on that, because we were at Scripps Institute a couple of months ago, and they were telling us how more than 80 startups have come from Scripps, and most of them are actually owned by the professors there.
Yeah.
So yeah, I completely.
So I think you started an initiative called Rich.
Yeah.
I think you should convert it into riches for the professors instead of
Absolutely.
just innovation.
Absolutely.
All right, on that very collaborative mode, let me come to you, Iqbal. I want to understand, where is India at the moment in its journey towards life sciences? So a lot of chatter around, we are like I said, pharmacy of the world. We're doing so much. There are plans being made, but still baby steps really. We're still looking at volume. India's still seen as a destination which will give you cheaper product, not somewhere which will really, people will come in. IP a huge issue.
Yeah, so you're quite spot on. If you see the diversity of the products, and if you put them, right from consumable to implants as the two, ends of this spectrum, we are somewhere between, an early part of, we have done well in consumables. Hopefully, we will start doing well in the medical devices spaces in certain segments, and eventually move up to, implants. But what's central for this journey to, really be predictable and achieved in a time is to think about a few dimensions, So the one thing, this sector is a sector which will have a very strong linkage with global markets, production centers. So this is one sector we keep on talking about global value chains. And here is one sector where we will have a lot of intermediate products, components coming in, flowing from various parts of the world. How do you create a framework which is both on the trade policy side as well as, manufacturing within the country that enables this movement of products and components between various, manufacturers and OEMs. Otherwise, one will end up becoming a hub for assembly at large, or packaging, but not a genuine component manufacturer. The second thing we'll have to see is that the way India went into auto sector, that we did very well on the auto OEM side, and we have very strong tier 1, tier 2 manufacturers. Like that, a segment like this will also now need to start thinking about the supplier ecosystem, which is the component ecosystem for the kind of players that are coming and reaching here. They are doing parts of it. Could we bring parts of component manufacturer for the larger firms we spoke about? I just want to remind you that this is an industry where we may have still 90% of our manufacturing companies below 100 crore turnover. So scale issue, which the Honorable Minister talked about, is where the opportunity is that they've started doing few things, but how do they really scale up to do more complex activity is what we'll do. And that's where, as I said, a mix of domestic manufacturing policies, trade policies, the way we are regulating certain products, and eventually bringing them all together is what would be central towards this journey.
Right, key issues there. I want to come to the Minister next, and closing thoughts really from everybody now on the important issue of capital and investment coming in. We've talked several times about the importance of private equity coming in, players really taking ownership of the entire space. But life sciences is tricky. Like you also said, the gestation period is really large. What are we doing to sort of encourage that? And if not, where is really the funds going to flow in from?
Well, you heard Prasad say that capital is actually, there's no dearth of it at this point in time in the world. Of course, people are talking about soft recession in the US, et cetera, et cetera. But I still believe that the India growth story, especially over the next 1 decade in healthcare, life sciences, is something that the world will actually take a lot of interest in. In fact, institutional investors across the world are looking at India, especially after the pandemic, with a great deal of interest. And I believe very, very strongly that there is no dearth of capital. But what are the sectors in which you would actually, within the life sciences spectrum, what are the sectors in which you would be able to attract capital? I think that's the larger question. Would you still continue to invest in APIs and generics, or would you rather move up the value chain and focus more on value and less on volume, and up your bottom line, if you ask me? So I think that's the piece where the world is not confident in terms of investor confidence. I think that is an area which is certainly something that we need to address. That is where all your points about IP protection, that is where all your points about encouraging and incentivizing research and development, all these pieces, if they are put together properly in terms of an enabling regulatory framework, I think then you'll have no problems attracting capital. Because there's no dearth of talent, there's no dearth of homegrown entrepreneurs who have become Indian MNCs and who've been, championing our, keeping our flag flying high across the world. So therefore, when you have no problem, no dearth of, investors, funds, or talent, what is the missing piece? I think it's the regulatory framework. It's the governments getting their act together, both state and center together, saying, listen, what are the things that we need to address jointly over the next 10 years if really this life sciences industry has to be given the much needed fillip? I think that's the only missing piece of the puzzle that we need to address. Everything else is in place.
And so you have some magic
yes, in fact,
under your hat.
From my state, because I only represent a state, I am coming up with a world-class pharmacity. I am continuing to grow my vaccine area. I am, of course, continuing to invest in the innovation. Like I said, the points of intersection between IT and biology, I'm continuing to invest in that. I'm continuing to goad investors to come in and invest in these areas. And most importantly, I have created a nice pipeline of talented human resources. All the institutions that Prasad mentioned, IICT, CCMB, we work very closely together with academia, industry, try and bring about a synergy between what the world wants, what the market wants, and what the academia should be doing. So we are doing some things as a state. Of course, there's more scope to improve, and there's expeditious delivery as well that we can do. But I think the larger responsibility lies with the union government in understanding and strategizing that existing ecosystems need to be given the fillip. Race to the bottom is not an answer, because when they launched this whole bulk drugs park scheme recently, Government of India, they were talking about which location would give cheap power and cheap water and cheap land. That is not how you should be looking at this industry. A race to the bottom is not an answer. It is the ecosystem. Where can India really move forward quickly? Because we don't have the luxury of leapfrogging. We have to pole vault. If you really have to, jump a few hoops and start thinking big, you have to pole vault. So you have to nurture your existing ecosystems. You can't be trying to reinvent the wheel and can't be going to places where there's nothing but water, power, and cheap land, and assume that the investor would happily come and invest there. That's not how it's going to work.
Yeah, it's good to see the minister so invested in the whole thing, and also, talking about policy where it's required. Really, your closing comments, sir.
I can't speak for the government, but I'm really happy with what the Honorable Minister is saying. But, even from a company's angle, we have to put more capital at risk. we have already conquered the API and generic segments.
Yeah.
The innovation business is not a natural growth of that segment of the business. It's a very different business. The API and generics business, you have large number of small bets. Whereas in innovation, you have a small number of very large bets. It's a very different risk profile. It's a very different business. The skills required are much very different and much more involved in creating new science. So it's up to us as entrepreneurs to do the big things. And I think we have some very ambitious entrepreneurs in India, and we will see innovation in the next decade. And we will get there. I'm very confident about that. I think we will close the unfinished agenda in the next decade.
The unfinished agenda. What's on your agenda next then?
No, I think I agree with the minister. You know, here is a sector which will create a lot of white-collar jobs. And as these will be high-value adding jobs, these will come closer to cities and leaders which will take a very clear focus on understanding how do we stitch what's called as an ecosystem together between academia, between industrial infrastructure, between startups, and also digital being a horizontal in enabling all this. Those will emerge, as hotspots for, future manufacturing and ecosystems in our country. And we are seeing, closer to Hyderabad, there's a lot of interest. So we see that if more of these happen in our country, because the opportunity is immense, and then we should be doing much more on that.
All right. On that note, thank you all very much for your time, and to all our viewers watching back home. And I hope you've got some good takeaways from this discussion as well. Thanks so much for watching. That's Money Control from Davos. I'm Sonal Mehrotra Kapoor, signing off.